Welcome back. Britain's Foreign Minister Dominic Raab warned that the roadmap to ease the country's lockdown is conditional. Joining us live from the United Kingdom is Jennifer Ringwood. Hello, Jennifer.
Hi, Alma. How are you?
I'm good. Thank you for asking. How are you? Good to see you.
Not bad. It's lovely weather outside. I wish I could be out there.
Anyways, yes. What are your updates for us?
Okay, so our updates today. Britain's Foreign Minister Dominic Raab warns that the roadmap to ease the country's lockdown is conditional on further data and the impact of changes that have already been implemented, as the death toll rises to 34,796. I'm sorry, I'm tongue-tied today. Meanwhile, England's Deputy Chief Medical Officer Jonathan Van Tam explains why Britain has added a loss of taste and smell to its existing list of coronavirus symptoms. Let's listen in.
9,408 people are currently in hospital with coronavirus, which is down 13% from this time last week. And I'm very sad to report that of those who have tested positive for COVID-19 across all settings, 34,796 have now died. That's an increase of 160 deaths on yesterday. We set a roadmap, but it's a conditional roadmap, and we will monitor very carefully based on the changes that we've made over the last week and see what impact that has. And we will assess where the R rate is and the other coronavirus data is before taking any subsequent steps, no earlier than the 1st of June.
And the important thing was to work out if this would add any sensitivity to the diagnostic cluster we were using, and the answer is it makes a small, very small difference, and we have therefore decided to do it.
Britain added a loss of taste and smell to its list of coronavirus symptoms Monday and broadened eligibility for tests as it seeks to prevent a second wave of cases when the lockdown eases. Prime Minister Boris Johnson's government is racing to implement a new track and trace regime to control COVID-19. After nearly 35,000 deaths, the worst toll in Europe. A major study by King's College London last week found that people with a positive test result were 3 times more likely to report loss of smell and taste than those who returned a negative test. Report author Sim Spector said that Public Health England's previous insistence on only including fever and cough as major symptoms meant thousands of cases were missed. The World Health Organization and other countries, including the United States, also now count it as a symptom. Meanwhile, British lawmakers on Tuesday heaped fresh pressure on the government for its handling of the coronavirus outbreak, calling its testing regime inadequate and in the early stages. But despite a recent surge in daily tests, the expansion of eligibility, MPs on a parliamentary committee said testing capacity has been inadequate for most of the pandemic so far. Capacity has not increased early enough or boldly enough. Capacity drove strategy rather than strategy driving capacity, they said in a 19-page letter to Prime Minister Boris Johnson. The findings by the House of Commons Science and Technology Committee come after 6 sessions of evidence involving scientists, public health experts, and government advisors, which also looked at other countries' responses to the virus. The government has come under sustained pressure about the spread of the coronavirus in care homes and the testing of frontline health and social care workers. Official data published last week indicated that more than 12,500 deaths of care home residents were linked with coronavirus. The committee said abandoning community testing on March 12th left care home residents and workers unable to get tests at a time when the spread of the virus was at its most rampant. The Guardian on Tuesday cited an unpublished government study and said temporary workers transmitted the virus between care homes. Health Secretary Matt Hancock, who maintains care homes were a government priority on April 2nd, it was announced that 100,000 tests a day would be conducted by the end of that month. Hancock has made an army of contract tracers a key part of a new approach to tracking the spread of the virus, alongside wider community testing and the rollout of a smart app. He announced on Monday that 21,000 contact tracers have been recruited and testing has been expanded to include everyone aged 5 and over with symptoms. A new target of 200,000 tests per day has been set for the end of this month. The government aims to use data from all three sources to inform its easing of lockdown measures, including the partial reopening of schools. Alma?
So what was the cause of the spike in coronavirus cases? And what is the government's plan to reduce the number further?
The spike, the increased spike?
The increase, yes, the increase in cases. Is it the care home fatalities or care home facilities?
Oh, I see what you mean.
Yeah.
I was thinking of the fact that we've started to ease the lockdown measures already.
Yeah.
I think what they were saying initially is that they think that the temporary workers were responsible for transmitting the virus between the care homes, which increased the death rate in those care homes, and also that these additional symptoms that we had not previously included may also have contributed to unknowing spread of the virus, because some people had reported loss of taste and smell, and they could inadvertently have been spreaders without even knowing it, because they weren't officially on a list and would have been expected to go to work.
So, as you said, lockdown measures have already been eased a bit. So what is happening in London now? What are the new normal measures in place now in London? Are you able to go out now?
Me personally,
Yes.
I'm in a category where I still have to wear a mask, so I would have to stay inside. I'm in the higher category, which I've only kind of realised in the past week or so that it's that serious for me. Other people, you can go out, you are encouraged to wear a cloth face covering as opposed to trying to purchase hospital grade PPE. And they are starting to say, especially the Mayor of London, he's been repeatedly on different media sources on the BBC saying that he is encouraging that, and now it looks like the government are also going with the same advice. Wear a cloth face covering so that you're not going to take away PPE from health services. Avoid public transport. Go to work if you are in a category where you need to go to work. And again, maintain the social distances. Be alert is the key word that they keep using in every newsfeed that I've been watching.
All right. Thank you very much, Jennifer, for your report. Thank you, EBC UK Bureau.
Thank you. I'm Jennifer Ringwood, reporting for EBC United Kingdom, and we live in interesting times.